Our pathology department played a very important role in responding to the COVID-19 pandemic. This was really prime time for pathology, especially the microbiology and molecular labs, but also sadly the autopsy lab. We were one of the earliest labs in the country to have a laboratory-developed test approved to diagnose COVID. And because we were one of the earliest, we also had opportunities to help and give advice to labs around the country as they brought up new COVID tests. I would say that our team was energized by this challenge. This is, what they live for. This is, diagnosing an infectious disease and the challenge of that. There was fear, but there was also an excitement around, wow, this is something new, and this is what we do, and this is what we do best. So we need to dig in, and we need to solve this problem for the public, for our patients. And so I loved seeing that aspect of our team.
And what we saw with COVID is all of a sudden this department, which historically maybe not, people aren't really sure of what pathology does, really was able to step forward and offer their expertise and resources to do lab testing that was so critical at the moment.
We were one of the few institutions that actually were putting a lot of effort into doing autopsies on COVID patients. And we were able to obtain, my colleagues, in particular Steve Salvatore and Alan Borzek, were able to obtain hundreds of samples from autopsy patients that led to critical studies that are being published in many different journals as we speak, elucidating the pathogenesis of this disease, the effects on patients, the types of cells that are infected by the virus, etc. And so I think that, and that's just sort of the behind the scenes, that doesn't even begin to speak to the amazing dedication that the clinicians here showed to their patients.
Many people really took on greater responsibility. Some people were working on the floors, on the medicine floors, essentially as medicine residents and interns, taking care of patients directly. Other people were doing more autopsies. Other people were doing more clinical chemistry and clinical laboratory work. So I think that sort of everyone kind of recognized that we have this large problem, we have to deal with it, and they really stepped up.
A lot of people during the COVID pandemic had to be pulled off of the services that they were assigned to and redeployed to services within pathology or outside of pathology. So I think, unfortunately for some of us, it meant maybe losing out on a few months of learning in the kind of organized way that it was supposed to happen, but it was definitely a learning experience in a different way.
I think in so many ways the department has risen to the task. I think the hospital has risen to the task. I think we've learned a lot, and hopefully we'll be able to use those lessons to get through the winter and come out on the other end in the spring.
And I just really admire the stamina they've had to continue working, which now January of 2021, since March. It's been really amazing and heartwarming to see the dedication of our staff.